This week, as we've mentioned, First Edition has been your back-to-school headquarters, providing insight to campus safety measures this year while even addressing the learning gap. We did that yesterday, and it's all been part of our back-to-school series, Classroom Challenges.
Today, we shift focus, how our districts are looking after your child's mental health. 3 News reporter Julissa Garza joins us live with the effort to address this mounting problem. Julissa, good morning.
Hey there, good morning. Well, like I mentioned yesterday, the pandemic was uncharted territory, and in more ways than one. It affected businesses, schools, and most of all, it impacted individual people of all ages. It's something one local clinical psychologist is seeing as younger patients walk through her doors. Mental health. A discussion being had a lot more than ever before, especially during the COVID-19 pandemic.
The stress level landed on everyone of all ages.
At the start of the pandemic, clinical psychologist Dr. KATHRYN SOWARD says she began to see more young adults come by, but they were soon followed by an even younger bunch.
We had a huge increase in K through 12 children coming in and needing therapy. The anxiety especially was through the roof, the worries and the nervousness.
Dr. SOWARD adds that as the pandemic progressed and more people stayed home, depression sank in for many. And when school returned, anxiety seemed to take a stronghold.
It took root, took hold, and cannot let go. And so now it seems like my practice has tons of young children and middle-aged children still dealing with a lot of symptoms of anxiety.
Dr. SOWARD adds that the stress and anxiety K through 12 students are dealing with is different from before.
Now we have children actually having full-blown panic attacks or refusing to go to school or having night terrors, really regressing in their ability to regulate their emotions.
Because of this, Dr. SOWARD encourages districts to find a way to prioritize mental health.
It is crucial at this time to get that started right now.
Districts like Flower Bluff ISD responding to that urgency.
This is actually our counselor area, and so you're going to see a lot of construction because what we're doing is we're turning this into a calming room.
The goal of this, to create a safe space for students.
On one side, we're going to have our military counselor. On the other side, we're going to have our LPC counselor right here. And then all along this hallway, we're going to have the rest of our counselors.
Robstown ISD also on the same page. The district even enlisting the help of 2 licensed social workers to provide extra support.
We put aside some additional funding so that our social workers are on call at any point to be able to reach out to those families that need that little extra support.
St. Pius, a school that relies heavily on grants and fundraisers, also making sure they set aside dollars to provide additional mental health resources on campus.
We also have a counselor this year we're really excited about. We also have a curriculum and social emotional learning curriculum.
Dr. SOWARD says the steps that these districts are taking right now are leading by example, and she hopes that more districts take note. So this is definitely something very important. We're seeing all these districts just be flexible with their budgets, trying to input as much resources for students as they can. Barbie, John Thomas.
Thank you, Julissa, for letting us know what those resources are, and of course, all the community as well.
Yes.
Very important.